Hello, welcome back to Men's Health TV. I'm Glenn Poole of the Australian Men's Health Forum. It's Men's Health Week, and you're about to watch Blokes on the Couch. Blokes on the Couch is where we get together three blokes who work with blokes in therapeutic settings, like counsellors or mentors or psychologists and psychiatrists. Today, we've got three great blokes joining us. We've got Adam Blanch of Good Psychology. We've got Carl Nelm of Blokes Psychology, and we've got Tanveer Ahmed. Dr Tanveer Ahmed. In this hour, we're going to be asking the question, how do we make therapy work for blokes? And how do we make blokes work in therapy? And we've got three men with loads of experience of that, so it'll be really interesting to get their take. But before we get into that, let's find out who's on the couch today. We'll start with you, Dr. Tanveer Ahmed. Great to see you, my friend. It's been far too long. Could you just give everyone who's watching, and also Adam and Carl, an introduction to who you are, how you got into this work, and what kind of work you do with blokes?
No, it's a pleasure to be on, and thanks for bringing us together, Glenn. Wonderful to meet you, Carl and Adam, and look forward to hearing your insights and experience throughout the hour. So, yeah, I'm a psychiatrist. I'm based in Sydney, and this presumably is an international show, isn't it, Glenn? So, I guess in Australia, it's not necessarily just, say, an NHS system, and you work in different sectors. So I tend to straddle a variety of sectors. I work in the public health system in a community-based area 2 days a week. And in Sydney, it's an area called Bankstown. And arguably, and I've often joked about this, the area is comparable to, say, Brick Lane in London or some of those places where it's very sort of ethnic, a lot of new immigrants, African refugees, Bangladeshis, Pakistanis, a lot of housing commission as well. So it's a real underclass mixed with kind of newly arrived immigrants. So it's a very interesting scene there in terms of just looking at social issues. I also work in private practice in sort of metropolitan Sydney, where I guess you get the garden variety, every kind of person, the family man, the elderly, the worker. And I also do a day of doing legal work, and that is primarily referrals from lawyers and seeing people in jail or insurance or work assessments, this kind of stuff. So it's quite a broad arena. It's pretty much, mental health has become such a bigger sector, if you like, in terms of the way people interpret experience, its overlaps with disability, with the law. So it means my work straddles across all these different sectors. So I've been a psychiatrist for over a decade. My background, so I was born in Bangladesh, came to Australia when I was 6 years old. I did medicine, but I was probably, I wasn't immediately attracted to the more traditional routes of medicine, and I found myself quite interested in psychiatry. But then within psychiatry, I mean, you see everyone in mental health, but I remember and obviously I think the cultural background gives you a bit of a different sort of angle too, because you come from a more collectivist experience, sort of these shame, honor cultures, and arguably I got more interested in men's health, possibly as a way to better understand my dad in some ways. Like probably typically where a lot of people grow up sort of going, well, you have sort of complicated relationships with your dad. And I think when that's probably magnified when you're from, say, a traditional ethnic background and you're growing up in the West. I think it feels especially distant. So arguably I had probably a strained relationship with my dad as a teenager growing up. And that improved as I became an adult. And it was almost arguably my empathy with men's health at a deeper level, if I kind of put the gaze on myself, was partly about me better understanding my dad and how he might have behaved, how he might have seen the world, and got us. And that probably was one direction, what got me more and more interested in men's health. But then probably, I guess another arm of my work is that I'm reasonably active in the media. Like I have a column in a national newspaper, and the column is broad. Like it's not just about health or mental health. It's really about how social issues might overlap with the political arena, with the business. I mean, my column's with the Financial Review, so sometimes in business, although that wasn't really planned, but that's challenging me. I'm sort of learning about that, or the workplace, or whatever issues it is. But that's probably where I came to sort of realize that there was a stronger political dimension to this, where I often felt I was giving fairly ordinary observations, or what seemed like just professional observations about men's health. And I had something of a scandal, if you like, a few years ago, when I wrote a column about domestic violence and what might drive some of that from an emotional angle. And you got a real sense that you touched on something highly politicized, and the real sensitivities about effectively being empathic about men's health. So showing kind of empathy about the different ways that men may exhibit or communicate distress was highly politicized. And that wasn't actually something I was familiar with up till then. So arguably that's probably made my acceleration into this field like even more so. So I guess I've developed something of a reputation for being interested in men's mental health and men's issues. And when I was talking about the different arenas of my work, I think that's quite relevant, because mental health, there are lots of doors, and mental health is not really one, if not the majority, but a good portion of people, they don't come for your product, right? And sometimes the product comes from them. And hence that's especially the case in the jail system. Often I'm doing fitness for work assessments where an employer has referred someone saying, well, look, this guy's having problems. Can you assess them and help us out here? So there's all these doors that people can come through in terms of treatment. And men in particular do not necessarily come through the traditional front door. So they don't as often come through the traditional door of, okay, I'll go see a GP, I'll get a psychology referral, and maybe I need to see a psychiatrist based on the advice of my GP, that kind of thing. That is not the traditional door that many men come through. And that's probably partly what's drove some of the expansion of my practice, where, I mean, certainly not just men, but there's such a big portion of the field that does not, that exists outside of the traditional health sector, which is probably partly why I've become much more interested in many of these other arenas. I've sort of been drawn to them and found myself very much in demand. So I guess I supplement that with my writing. While I probably, without wanting to, I probably do have, in certain portions of the media, I probably am known for being interested in men's health, and I may be called names, less complimentary sometimes. Yeah. Even during the week, I wrote a column which caused a bit of a low-level stir, if you like, where I argued in modern power circles at the moment, you could be a male African refugee up against the daughter of the Prime Minister or billionaire, and according to modern diversity targets, whether it's for boards or political pre-selection, you will actually, the male, regardless, will lose out on the diversity fight, if you like. So there's an example. I wouldn't cast that as me some sort of, activism for men as such, but I'm certainly interested in all the shades, and mental health is especially interesting as a writer because it overlaps arguably the most with the world of ideas and stories and politics and society. So I think it brings together a lot of my work, both seeing individuals, but then trying to either comment or interpret or influence things on a bigger scale.
Right. Thanks, Tanveer. And there's a whole program there on the sort of the overlap between therapy and the political space, which would be fascinating to unpick. We're going to have to come back and do that another day, I guess.
Well, I should have plugged my book there, Glenn. I mean, effectively, one of my books is arguably about what you just said, which was called Fragile Nation. I should have pulled out a copy, actually.
Okay, well, we'll pop it in the comments.
Yeah, absolutely, yeah.
Let's get to know the other blokes too. So, Adam, I'm going to come to you next. So just as I'm sort of, introducing you, I'm remembering where I first met you. So obviously, Tanveer, I actually met you through your scandal. Adam, I remember meeting you probably in about 2013 when I came over from England for the National Men's Health Gathering, and have been on some email forums and stuff with you about men's health. But yeah, I haven't seen you for ages, so it'd be good to hear, how you're traveling and, what your journey is into this therapeutic space and what kind of work you're doing these days.
Thank you, Glenn. Yeah, I think my story is quite similar to Tanveer's in that I got into the men's health space really through my own needs, my own sort of recovery from trauma and health and well-being needs, and spent probably 30 years in the men's space with different groups and different organisations. Got to about 40 years of age, decided I better figure out what I wanted to do when I grew up, and went to university and did a Bachelor in Indigenous Studies around trauma, and then moved that on to postgrads in psychology. And again, you know, so very much my focus with people is working with trauma and the after effects that come from that in terms of how it affects people's lives. But inevitably, like Tanveer, I found myself mucking around in the political space, not through any intention or desire to do so, but because once you start talking about men's health and you start talking about men's trauma and men's well-being and men's experience of violence and you know, the sort of the male kind of experience of the world, you very quickly find yourself the target of groups who seem to want to not have that spoken about. So I work in private practice currently. I have my own practice called Psychology. I also work through a group, a new group called Rural Health Connect, who are this fantastic social enterprise trying to get rural people more access to psychologists. And I've worked in prisons, I've worked in community health, I've worked in family services. So pretty broad range of experience there. And I'd say probably 50 to 60% of the work I do is with men these days. Not necessarily deliberately, but I find that a lot of men want male counsellors, and they're hard to come by. So they tend to find me. I'm saying a lot of ums, aren't I? And you know, like Tanveer, I also do a bit of writing. I used to have a regular column in Pro Bono, and I'm working on a couple of books at the moment around healing trauma and empowering people who are traumatized. So I think that's about me.
Great. Well, thanks for being here. Looking forward
Thank
to
you.
seeing your insights of you know, how you're applying your knowledge of being a bloke in therapy, and also a bloke giving therapy to blokes. What the insights are that you're developing. So probably the person I know least well on this panel then will be Carl. And you know, to be absolutely clear, the key reason you came across my radar was because of the way you've actually advertised yourself to the world as, you know, doing blokes psychology, which is, I think, is just such a fantastic idea. I'm sure there was loads of other people out there kicking themselves when they saw that you'd grabbed that. But you know, it's not just a gimmick. You clearly know your stuff. I've seen you out in the media commenting as well, and really delighted to have the opportunity to spend an hour with you and find out a bit more about the work that you're doing, Carl.
Oh, thanks, Glenn. It's probably about time that we caught up and had a bit of a chat. So a bit about us, I suppose, probably a bit different to the other two blokes. I'm a bit earlier to this space than probably you three are. Bloke psychology, pretty self-explanatory. We're a mental health clinic, essentially, for boys and men of all ages. And we've been going for about 2 years now. And long story short, it spawned as just an idea. I was kicking around with a supervisor about 2.5 years ago now, after quite a big day working in Gamblers Help at the local community health centre. And I was having a chat with a client, and it was evident early on in that session that he probably should have sought support 5-10 years ago. And I pretty much said to him, why is it taking you this long? And he didn't hesitate at all. He just said, mate, where would I have gone? And I said a bit naively, I said, well, there's plenty of private practices or mental health supports or clinics everywhere. And he said, mate, where's a bloke to go though? He said, they're all feminine, well-being, flower power, cognitive behavioral this, or DBT that. He goes, where do blokes go? And it was literally 2 hours later, I was in my supervisor's office up the road, and I was saying to her, like, it's almost like there needs to be this bloke psychology clinic or something. And she literally just said, well, why don't you do it? And I said, oh, I'm too early in my career. I couldn't do that. And she said, look, I've got a spare room. Why don't you just try it and see how it goes? So I spent the next few months just building the website, toying with the brand, and did a lot of work networking and trying to get the name out there. And ever since we opened, we've been chasing our tails. And as Adam said, the biggest challenge actually for us is not to find clients, it's to find male clinicians to come and work for us.
That's me not unmuting.
Yeah.
Still. So, excellent. We've got three blokes who in different ways have found, it sounds like you all in different ways kind of walk sort of sideways or backwards into the position that you're in now. So the question I wanted you to sort of chew over is these two sort of like interrelated questions. Firstly, and I wanted to make it not about, how do we get blokes to get help, which is kind of, I want to be a bit more subtle than that, which is, so how do we make therapy work for men first and foremost, whether that's how do we get them through the door, or once they're in there, how do we actually approach it differently? What have you learned? And I'll come back to you, Tanveer, first. So, what are your thoughts on how do we make therapy actually work for men? Is it different? Or is it just a case that once they're in there, they're just another human being and you just treat everyone exactly the same?
Look, to some extent, it's a bit of both. Like, I do think they're more likely to be referred through other means. That's probably the most obvious thing I see in terms of the men that may come through my door. They're far more likely to be dragged in by their wife or sent by their work, or they've come up against problems either in their employment or through legal trouble or financial trouble, something like that. So I guess one of the key areas, which can be both a problem and a opportunity, is it will be much more specifically related to a practical problem, which in some ways is a good thing. So it gives you an opening straight away that, okay, we're working on this to get you back to work. We're working on this to keep you out of jail, right? We're working on this so your wife doesn't leave you, right? So you can make a very strong interaction there. Whereas a lot of other people will come primarily because they're distressed. They're emotionally distressed, and that's enough for some to get a referral to come and see someone like me. Whereas many males are far more likely to need a clear, measurable problem in a way that their distress must be linked to in a way. So I think that's one way. It's different doors, more specific problem, a very more practical interaction in a way. The interaction is more practical. And I do think I do relate. I mean, obviously you have to tailor your interaction according to sort of class, education, cultural background, all of that kind of thing. So especially, I mean, both my roles will have big overlap with, I guess, the traditional, what might be called the working class male, if you like, the tradie or the factory worker, etc. And I do think you do tailor your interactions there. And what I've found, you often need to almost trick them into giving a hint into their emotional lives. And I think I, over time, become much more skilled at that. So not as direct. In the same way you get this, I guess, a stereotype that men don't like the face-to-face or eye contact. It's more side-to-side. And I think that exists in a non-physical way as well. So rather than be too direct and saying, right, tell me about your emotions, or do you want to, have you had suicidal thoughts? And sure, you can get to that. Often you're better off talking about something very practical, like, learning about their work. So what is it that you do in your job? And you'd go through that in a really kind of, almost in a deep sort of way. Go, you take this widget, then you do this, then you do this. And that can actually really help really build rapport. And it's almost through those sort of lens. Then from there, you can sort of go, okay, what sort of problems you've been having there? Well, it's because at this stage where I have to talk to my manager and I do this, blah, blah, and I'm having trouble doing this and I'm not taking the information here, or whatever it might be. But it's a marker that often you talking about a specific interest, be it work, be it a hobby, or maybe what they're doing with their kids, something like that, but almost in a very detailed way. And this is where it is almost a type of literature in a way, where you're getting this real depth to, to a task or to a world. You're getting a real sense of their world, but that world may not initially be bound in the emotions, at least not in a very visible way. But often you need to set up their world, their non-emotional world, and you set that up. You kind of, it's like a sort of like a theatre set. You've set that up, and that's when you can really start entering. And you go, right, and now let's try and work out who you are and why you've come to me today. How is that trajectory playing out, and why is something tipped you in this direction, right now? So, and that's a very exciting part of this sort of job, where you're getting a real sense. People, every time they come into the door, I sort of explain to them, there's a reason you've come to me now. It's often in a transition phase of life, or, be it some sort of crisis or whatever it might be. And when you give them a sense that you're not here, they might come in and say, I'm struggling to concentrate, right? But everything they come in with will be just it'll be the tip of the iceberg. So that's just a superficial. So men are likely to come in also with almost like superficial problems. And that's very common for me, because I can prescribe stimulants, for example, dexamphetamine, Ritalin, etc. So that's a very common reason both boys and men come through the door, right? But often that's a marker of a kind of emotional unsophistication. Right? What's really going on, they have a bad anxiety disorder. They grew up in a conflicted environment, and they feel easily threatened under pressure, and they get anxious or overwhelmed, and how it comes out is, I can't concentrate, blah, blah. And often they'll see their problem through this very limited way. And Your job is to show a much bigger sophisticated picture of that problem, but then ultimately come back to that problem.
Yes.
Because that's what they've come to you for.
Yeah, right? That's what they came for. Right?
Look, I do think there are, I definitely, I guess, I mean, you tailor your interview and therapy to, according to whoever comes through the door. But I guess things I've seen with men. So, much more practical. I avoid psychobabble as much as possible, but there's certainly some people that like it. So, but for most men, I would use very little psychobabble. And by that, I mean just kind of technical psychological language. I would use very little of that. And the reality is, like it or not, a bit like drug and alcohol treatment, the evidence is low-level coercion is actually quite effective. And by that, I mean, again, tying it to something they really want and showing them there's a chance you're going to screw this up, i.e. you do this, this, and this, we'll keep you out of jail, or we'll keep you in the job. You do this, this, and this, your wife is far more likely to stay with you, or you're far more likely to be able to see your child, or this kind of stuff. So really give them a clear goal and almost a soft coercion, right? Yeah. And that may not be politically correct, but I actually think that's clinically quite effective.
Right. So there's a couple of things I really like about what you were saying there. One was that idea of like building up this kind of framework in the practical external world to provide the sort of foundation into which to get more into the sort of the underlying layers and the internal world. And also those then focuses on the results, the goals, the action orientated stuff. And I think those are some of the ideas that, and they sound very simplistic when you first say, I mean, you didn't say them in a simplistic way. You said them in a very nuanced and detailed way. But how I would have simply said that, which may have sounded like, pop psychology, is in my experience, men tend to engage from the outside in rather than the inside out as a starting point. And so if you can meet them in the outside world, whatever it is they're talking about or focused on, then you can actually gain entry into the interior world. But if you go straight into the interior world, tell us how you're feeling. How do you feel about that? Often there's just there's no framework, and there's no connection, and there's no language for them to, because they don't necessarily normally process the world from a feelings language kind of perspective. And then actually making it actually relevant to them by going, if you do this, there is actually a point to this, because if you're going to keep your wife, you're going to keep your job or whatever it is, that's what we would generally call goal orientated. And so, yeah, even a very beautifully therapeutic and nuanced and complex way, to my mind, talked a lot about the value of working from the outside in and making sure that there's a goal at the end. So, so Adam, we'll come to you. What are your thoughts, and what are your experiences of both as a bloke yourself, but as a guy on the other side of the couch? How do we make this space work for blokes?
I get pretty cranky with this idea we have that men don't seek help, Glenn. Men seek help. It's just we're not providing it in a form that they recognise. As Carl found, everything's very geared towards women, and it's very feminised, and it's very, and the most common complaint I get from men, and quite often from women, is that, they went to a therapist, and the therapist sat there and nodded and said yes, 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 and did nothing, suggested nothing. Right. So, the way I do it with men and with a lot of women is I basically say, listen, I'm a brain mechanic. Okay, you tell me what's going on. I'll tell you, what's happening in your brain and why that isn't working for you. And then we'll figure out together how you're going to fix that. What I love about working with men is that they're very active clients. They're not sitting back waiting for someone to fix them, generally speaking. They're like, okay, well, you give me the strategy, I'll apply it, I'll use it. Like with Tanveer, I said, one of the things that I introduce men to is their emotional world, because they've been taught that that's off limits, that's weakness, that's, you shouldn't be do that quite often. I just say, well, listen, here, this is what your emotions are. They're the things that are telling you whether your needs are being met or not. The positive ones say, yes, well done, keep that up. The negative, so-called negative emotions, which are painful, say, no, that's not working for you, try something else. And I just explain what their emotions are and how they work and what the function of each emotion is. And for a lot of men, the light goes on. They go, oh, well, actually, what you're actually telling me, my feelings are my allies here. And the problem is I haven't been listening to them. I haven't been letting them inform my decision-making in life. And once they get that concept, men run pretty hard with that. And this is what I find with men. Once you give them good knowledge, good strategies, you say, listen, go and do this, see how it works. They will go and do it. And they've been kind of culturated towards this idea of, if I've got a problem, it's my job to solve it. Now, that can be problematic when, they go, well, I'm not going to ask for help sometimes. But it's also very helpful once you've engaged them in a solution-focused kind of way of doing things. They'll take it and they'll run with it. So, I love working with men, and it's made me a better therapist with women, because what I'm finding is that, after that kind of first session of yes, 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 and oh, that must be hard for you, and all of that kind of stuff, most women are also going, right, okay, what's the solution here? So I think as an industry, we've been a little overtrained in empathy, and a little undertrained in, if somebody's coming to me as a therapist, it's because I have knowledge they don't. I don't take my car to the mechanic and you say, it's broken, and he says, well, how do you feel about your car being broken? And, what do you think's wrong with it? And it's like, I don't give a shit how I feel about it, mate, fix my car. So I think we've been a little overtrained in that kind of, and it can make clients dependent, and most men don't want to be dependent. They want good information. They want to get on with it. So, I'm sure Carl will probably suggest the same thing. If you give that to them, men are pretty good clients. I'm done. I can't hear you, Glenn.
That's me. Honestly, I've been on Zoom for nearly a month, and the cracks are starting to show. Can I just share how I feel about that with you? Actually, no. Give me a solution. Have more caffeine. That's what'll work. I don't care how I feel about it. What works? So yeah, really great. So I mean, where you're coming from is, and I think what you led into there was the whole retention piece, right? And I think the sort of the research backs that up. But that's often then in that, you know, men are seem to be less likely to stay the course in therapeutic settings, and then that's often interpreted as, well, they're bad patients. Men are just bad patients. They don't do being a patient as well as women. And what you're talking about is saying, well, you know, there's loads of blokes who get help. Often they try it and they find it just wasn't for them because the help that they got. And we also know that first interaction can be really with a service or a helper, can be really vital, and that there's a real opportunity. That's an opening to work with men. Often that first sort of reaching out, and if we handle that badly, that can push men away from services for a good length of time, because it then becomes, I tried that once, and it wasn't for me.
Can I briefly jump in on that, Glenn? I mean, what I say to other practitioners around this space is, by the end of the first session, your client should have a formulation of what the problem is and know that there is a solution, and you're going to help them find it. That will bring men back to the room.
Mm.
If they just felt heard by you, they go, well, you know, all right, that was nice. And one more thing I think I want to add, though, is men are a different animal. You know, we're talking testosterone levels 10 times the level of women. We're talking dopamine issues that you know most women don't face. Men are a different animal. If you want to work with men, clinicians should be across the differences. I mean, there's a lot of similarities with women too. We're all human, but across the differences in men's experience of themselves and of life as well. So I'll stop there.
Well, that's good. And Adam throws in the whole nature versus nature opportunity for us to open up or take on in another program. One of the things that I say when I'm working with people about how to just generally work more effectively with men is that, you know, I don't care if you think it's nature or nurture, but you all know from experience that men and women show up in your lives in different ways. And it's like, you know, who cares? Who cares how they got there? But yeah, from different animal approach, that's certainly a position to take. So, Carl, I'm going to share something with you first, Carl. We've just been working on a report called How to Make Services Male Friendly, and it's like 10 key principles. And principle number one, and we've sort of like synthesized lots of different health projects, mental health projects, social projects that are really good at engaging with men, and that's what are the common strengths of those types of approaches. Principle number one is that they target men directly. I mean, use as an example quite a new project in Canberra called Men's Health Down Under, which is because pharmacies is another place where you don't get as many men as you do women. So Men's Health Down Under, great bloody name, is entirely focused on providing pharmaceutical services and support service to men, and it's going fantastic. And because they've actually gone, look, blokes, this is where you go, and blokes have gone, all right, that's where I go. Fantastic. So is the answer for you to this question really simple, that you've actually found the solution? You just added blokes in front of psychology, and now you're up and running, or have you got more to offer us than that, Carl?
I would hope we got a bit more to offer, Glenn, but I mean, you're right. We are very lucky in the sense of a lot of people end up in front of us or calling us up because of the name, exactly as you said. And I'm not surprised that's the number one suggestion for male-friendly services. But I think similar to what the other blokes have said, there's a few issues going on. One, I think there's a real issue in psychiatry, psychology, just therapy training in general. I know myself and a lot of colleagues, we get taught this sort of one size fits all. And what it assumes in a lot of therapeutic approaches and sort of client-centered therapy is that the client in front of you wants to be there. Now, this is a generalization, but most blokes who I see, now the 20 blokes I saw earlier this week, part of them might want to be there, but there's a large part of them who doesn't want to be vulnerable in front of me, paying money, taking time out of their day to talk about their problems or their issues or their challenges with another bloke and get support. They truly don't. So firstly, that needs to be looked at. But then I think I think you had Zach Ziedler on another initiative recently, the suicide awareness initiative you had recently, Glenn, and him and his research team and some other research teams around the world are popping up over the last few years about the treatment differences in terms of outcomes for men versus women. And I think those two themes that have always stuck out for me are transparency, which Tanveer and Adam both spoke about, being really transparent and upfront about what this is and what's going to happen, and almost orientating them to therapy, to counseling. Because, I mean, I had a client yesterday, I spent 15 minutes of that session actually orientating him to what happens today and what happens in the next session. Because it's fascinating if you actually read some of the research, the semi-structured interviews that they conducted. Blokes who dropped out early would often say, I was just rocking up, paying a couple $100, wasn't sure where this was going. Were we heading somewhere, or was she just, or he or she just listening and nodding her head and validating me? And they need to feel that sort of pragmatic mind we have, the caveman brain that we all know too well, is very solution focused. So they need to feel that they are heading somewhere. This is the goal that we're heading towards. And just lastly, to touch on what Tanveer said, that coercion, to trick clients. I often say when I'm asked about this, CBT or ACT, all these lovely therapeutic interventions, they're fantastic, but oftentimes, and I'm sure Adam, you can relate to this as well, that's the hook that almost gets clients buy-in. If I send client a resource, or if I tell him in the first, second session to go away and do this, or try this, or give him some psycho-ed on anger, or some breathing, or whatever it is, and he comes back and he goes, shit, that actually made a difference. You've got their buy-in, and as soon as you got the buy-in, that's when the deeper work can begin.
Fantastic. Now, I was going to then take us into the world of, well, how, once you've got the bloke in there, how do you get into work? And it's almost like you've already answered these questions. That's not actually even a conundrum in terms of the approach that you're taking. Clearly, it is for some psychs that haven't got some of the sort of ideas and thoughts that you have. But I wonder if we actually just pull it out and say, because you guys are already doing the do, and you've already demonstrated that blokes will work in therapeutic settings, and there's some approaches that you might want to take that work more effectively. But that doesn't seem to be necessarily the experience that men have with most, or all certainly, psychological settings. And you touched upon there, Carl, the whole idea of well, you particularly in your introduction, you talked about how the therapeutic space just wasn't for blokes anyway, and then you've now lent into the fact that there's no real focus on training to work with men. So what do we actually need to do to not to get blokes into therapy, but actually to make sure that more of the therapy that blokes get into is bloke friendly, male friendly? How do we do that? Because clearly we're preaching to this little room, we're preaching to the converted here, but there's a whole industry out there. So how do we make the whole industry more male friendly, Carl?
Well, I think Movember, are in the process of creating a training and an actual manual for working with men in the therapeutic space. But I think more broadly, if a therapist or a psychologist, counselor, psychiatrist, whatever it is watching this, it's about putting that clipboard down and actually addressing the person in the room first, which sounds so simple, but especially for our service, we get a lot of guys come in saying, this is my last attempt. Like, I've seen 2 or 3 people, I didn't click with them, or I went 6 sessions, it just didn't hit the mark. This is my last attempt. And I'll always ask a few questions. Well, what was it about that? And again, I think it's just, you'll have a bloke who might be really sort of ochre or stereotypically Aussie male, and that clinician, whether male or female, has just applied that same first session sort of equation as they would any other male. And like Tanveer said, like Adam said, and you highlighted, Glenn, touch on the external, building that rapport first. I've had teenagers who said to me at the end of the session, one actually said to me a few while ago, he said, if you'd picked up that bloody clipboard, I would have walked out. And I think that speaks volumes.
Yeah. Great. So put down the clipboard. There's the first one. Adam, what about you? What can we do to actually change the culture? I mean, is it, for example, about getting more blokes into the industry? Because I don't know what it's like over here, but last time I checked in the UK, about 80% of people going to university to train in like psychology were women, for example. So is it about getting more blokes? Can women be bloke friendly? Is it just about putting down the clipboard? What do you think, Adam?
I remember I was sitting in a master's degree at university and suggested that maybe we needed some affirmative action around getting more male psychologists, and you can imagine how that went down in the room. But I think that's definitely one solution. But in terms of the way the entire kind of culture. Let me put this differently. If you want to make male-friendly services be friendly to males, it's. I remember working in the Victorian prison system, and there was a very stark difference between the way female prisoners were treated as kind of poor, injured, traumatized people who needed healing, and males were treated as rabid dogs who needed to be controlled and reconditioned into being. Of course, if you're sitting there in front of 12 prisoners who have done violent crimes, I can tell you without asking that their background is not going to be good. That these are people who have been abused and neglected and traumatized and grown up in hard environments. And what we're looking at is trauma. We're looking at the very predictable outcome of childhood trauma, but we're not addressing it with men as if that were the situation. It's almost like Pavlov's dog. Oh, they've got this bad behavior. We've got to change this behavior. Don't worry about the human being that's behind that behavior. So there's a very broad cultural context that has to change in terms of, that men are not they're fairly well dehumanized in the way we speak about men. So within the room, that's very clear. It's, for me, it's when I'm working with a guy, it's like, well, I'm not going to tell you who to be. You know who to be. You know what your values are. You know what your aspirations are. I'm not here to tell you that. I'm here to ask you, are you getting where you want to go in life? Is what you're doing getting you? And invariably the reason they're sitting in front of me is because it's not. So then let's talk about that. I'm, call this client-centered if you want. I'm here to help you reach your goals. Now, along the way, I may have to show you where you have beliefs or attitudes or ways of doing things that really aren't working for you. But I'm very clear that's not who you are as a person. If who you are as a person is, basically what you feel inside. And if the behavior that you're doing doesn't match that, well, let's figure why that's a problem. So in terms of how do we make things more male friendly, we be more friendly to men.
Beautiful. You sort of leaned into something there, which is one of my favorite sort of observations when you get into the cultural conversation. And again, this is kind of like a stereotype, or is it an archetype? It's one of those that seems to has a certain truth about it. That when we look at social problems, we tend to think that women have problems and then men are problems. And so, so if men show up as a problem and you can put them in that box of being the perpetrator or the cause of their own problem, then you've got a justification to engage with them. But it's very difficult if you want to move out there and put together a project that works with the problems that men have. And that's the kind of that's where that kind of reinforcing of gender stereotypes really actually works against. And we've not really lent into that. And recently there's been some research on moral stereotypes, which kind of in a more academic way reinforces that kind of idea that when we look at the same issue or the same behavior, if you put gender on it, we view it very differently, whether it's a man doing it or a woman doing it. And that goes right down to things like our willingness to vote for politicians who take a stand for a certain policy, or to our willingness to give money to a certain charity. And so I went through a process. This is an idea that's only just bubbled up recently. The men are problems, women have problems. It's sort of framed a lot of my thinking for many years. But more recently, something just landed for me, which I hadn't noticed before. And it was in looking with work with separated dads. And this is, to lean into the piece that you're talking about broader culture, about broader culture change. So when dads separate, one of the things that happens is they're at risk of harming themselves. There's a suicide risk. So there's definitely a call for actually focusing on that. But also what happens when people separate is you get an increased risk of domestic violence. So dads harm others, right? So dads are at risk of harming others and at risk of harming themselves. But also what happens to dads is that they get harmed. They get harmed by a system. They might get harmed by their ex in different ways. And I was looking at it and thinking, you can make the case that you need a service to support dads who do harm. In fact, if you do that, that's the best way to actually get funding and support. More recently, we've actually been able to sort of lean into the idea that men may harm themselves. And so there's a more willingness to sort of do, but now those two things are getting conflated together. To actually focus on the idea that men are harmed, it's almost impossible. There's this absolute blind spot in all of that. And it seems to me that when people separate badly, they're doing all of those things, whether they're male or female. They're a little bit of harm as well. And it's really interesting to me that it's a very difficult thing to start a conversation about the idea that men are the recipients of harm at the hands of someone or something else, which is part of the reason why it might be hard to actually put forward support services for men. Anyway, that's my little aside. Tanveer, we're going to come to you now, and it's like, how do we make this? I'm actually going to lean into your politics potentially here, aren't we? So how do we make the system? How do we make culture? How do we make the profession better at engaging with blokes?
Look, I mean, I guess that's where it becomes inescapable to some degree, as Adam was alluding to. And I think that what I enjoyed about him when he was talking about we've overplayed empathy, I think what he's really alluding to is a feminization of some of these spaces. So there is an empathy gap. The way we view empathizing may have a sort of feminine bias, so this focus on sort of feeling, etc. And even a lot of the focus on male mental health is let's help men be more like women. It's like, have a good cry and this stuff, and then you'll kind of get better. And I'm not sure that's always the right strategy. So I think there's a lot of overlap in psychology with some of the problems you see in education, where it's a very feminized space, and you have a lot of, say, boys who don't always fit that space, and you get, I guess, troubled boys who struggle to find mentors or people they make good attachments. They struggle to find healthy male figures, especially if they come from, say, fatherless families, etc. Some of that, I think, plays out in mental health too. Certainly, I mean, most people don't need psychiatrists, but say in the world of sort of social workers, counsellors, psychologists, I mean, that is a very feminine space. So I think what both Carl and Adam were alluding to is partly related to that, where they'll go to someone but just don't feel adequately heard. Maybe the manner and the style is it's just not well tailored. I think it is a feminized space to some extent, and this is where to some extent there's only so much we can influence the broader politics. I think a simple thing like having as in more male psychologists would be useful, and I think that is starting to happen. It's certainly. It's a prestigious career. I think it's a great career, and I think that is beginning to happen a little. I feel like I'm seeing more and more male psychologists that I can refer teenage boys to or other men to. And to be honest, I think that is a big difference. I actually think that makes a big difference, because many of the men I see, they're far more likely. I mean, not as a general rule, but they're far more likely to form a good therapeutic relationship with a bloke, like it or not. And sometimes that is to do with their earlier life too, because a lot of troubled men is because they had messy relationships with dad, or they came from violent alcoholic household or whatever it might be. And sometimes repairing a bit of that depends on being able to form a good attachment with a male figure. And the vice versa too. Sometimes they actually need a female figure. But the reality is progressivism has a feminine bias, right? And and a lot of the social justice movement, et cetera, the reality is all of that has something of a feminine bias. And like it or not, an element of that is to drive traditional masculinity out of the public sphere, right? At the most extreme levels, if you like. So this is where some of it is inescapable from politics. Again, I think some of that is improving. But you look at, say the rise of someone like Trump. It's a great example of, it's almost a half century of liberalism. I call Trump the id, the Freudian id of the Western world. And he's the ultimate kind of traditional male. And there's almost this big kind of middle finger to a half century of progressivism and its sort of feminine bias. And it's an extreme version of that. But ultimately what both Adam and Carl at a much more policy level does depend on us, at least a little. We all want good services for men and women, but at a bigger political level, some of that is because there is a feminine bias at the heart of a lot of elite politics, like it or not.
Right, so that's the second description of Trump we've had in 24 hours. The last one came from our friends in the mythopoetic movement, who referred to him as the classic high chair tyrant.
Oh, he can be both.
Indeed. So we've got 5 minutes left. I wonder if we sort of bring it back to the personal and think about any blokes who are watching this, or anyone who's got blokes in their life that they may be concerned with, and is maybe thinking, I do know that I need to try and get something, but I'm not sure what it is. I'm struggling a bit. Life could be better than this. What's our advice to blokes? Where do they go? So, Adam, come to you first.
Oh, that's a hard one, Glenn, because there's not a lot of places where they can go to get kind of male specific help. You can send them to a men's shed or something like that, where they got to get companionship and support and all of that. That's great. But and I want to be clear, I'm not saying that women can't help men. There are very, very good female counsellors and psychologists out there. For men, I'd say though, what you're looking for is someone with a bit of age and a bit of experience. It's not that, younger people can't be effective. It's just that you've got to, particularly in the modern world, there's a kind of, as you've said, there's a blind spot to men, and it usually takes a few years for people to get past that. So look for somebody with some experience, look for somebody who's, trauma informed, who's solution focused, who's talking about brief therapy rather than, just CBT or humanistic. Give them a call and ask them what their approach is. Ask them what they're about, sort of thing. Or read their profiles and go, are they solution focused? Are they just kind of, or am I just going to sit here and be heard, which isn't really going to do much for me? That's what I'd say.
No, that's excellent. I mean, what I got from that actually is just I got a sudden ping, which is like, we need to make people more aware of the different ways of getting help, to make that we often talk about making it culturally normal to sort of like, say, are you okay, and all the rest of it, but actually, and building awareness, but it's like actually more awareness of the fact that there's lots of different types of help. And some of those types of help can be really great for blokes, and some of these types of help can be really great for women. And sometimes blokes with a certain thing might want that kind of help, but with another thing they might need another kind of help. And to sort of get beyond the idea that there's just like this one homogenous blob of stuff called therapy, even that would be really beneficial. And to have more blokes out there talking about the difference between feelings-based approach and solution-focused and all the rest of it. Yeah. So Really nice. I like what you're putting down. There's sort of like the pessimism of there's not many places to go, but the optimism of what we could do. So, Dr. Tanveer Ahmed, what's your advice to blokes?
Yeah, look, I think what you're saying, Glenn, is what Carl was saying earlier, that often people need orientation to this whole world. So, I mean, the first thing is to say is that you can be helped. And part of the reason you're experiencing distress maybe is that you've incorporated a view that you can't be helped or there's no one to be helped. So the very first solution is you can be helped. Two, yes, the system, if it's working well, will tailor that help according to you, right? And maybe I think that's where the system can fail blokes to some level, where they don't necessarily feel like they're getting that that direction or a sense of, like Carl was saying, that here's bang, this is what we're going to do for you. Here's over the next sort of 3-6 months, this is what's going to happen, and we're going to get you from A to B. The other thing is, with the symptoms they're feeling, especially if they're relatively new, most people walk through their lives without really having they don't need to. You just go about your life. So it's rare people are actually forced to confront, who the hell am I? What's the point of my life, etc. So it usually means you're going through a transition phase and need to reintegrate. It's like you refashion yourself a little at different stages of life. And often, not everyone needs that, but often you do need someone just to help you. The solution is in you, but often you need a reflection, just someone reflective, bouncing, reorienting you, helping you kind of set up new languages. So I think if you want some quick picks, you can be helped. The system is there to help you, and if it's not working, it's not personal. It's mainly bureaucratic, right? It's not personal. It's not means that it doesn't want to help you. Something's gone wrong at a bureaucratic level, so don't necessarily give up. It's very hard to do it on your own, and not just at a professional level, but also at a personal level. Because that's another real problem I see, where people come for help thinking they can leave everybody else out. And obviously there's a lot of shame, stigma, and it doesn't necessarily have to happen at first appointment, but it's very rare can you do it on your own. So you can't, one, there is a solution. If it's not working straight away, it's not personal. It's bureaucratic. And 3, you can't do it on your own. You need help both at a professional level, but also with your own resources.
Great. Thanks, Tanveer. And Carl, apart from obviously pick up the phone to Blokes Psychology, what's the tip for blokes?
I think similar to what Adam said, is actually suss out, is that service for you? We have a lot of guys actually put in requests, hey, can I speak to one of the clinicians first, have a 5-minute phone call? So then services might not advertise that, but if you request it, I'll probably do it. And within a few minutes, you're going to tell very quickly whether you can relate to that person and whether it's worth going in for a session. But just lastly too, Glenn, as you said, whilst there's still probably a huge gap in terms of male-friendly services, to put an optimistic spin on it, there's never been a time that there's more male-friendly services. All of us and what you guys are doing at the Men's Health Forum and all of the services in the man space, there's so many different versions of support. So do some Googling. Never been an easier way to access that information and find out what is that first step for you.
Great. Thanks, Carl. Great way to finish off. This has been Blokes on the Couch on Men's Health TV. I'm going to say thank you to Carl Nelms of Blokes Psychology, Adam Blanch of Good Psychology, and Dr. Tanveer Ahmed. We'll say goodbye now. We'll be back at 5 p.m. this Men's Health Week for our final Men's Circle meetup. Thanks for watching. Please do like and share with friends, share with a bloke in your life, and check out the other great programs we've had on throughout the week. Tanveer, Adam, Carl, thanks so much.
Thanks very much. Lovely to meet you guys.
Take care.
Take care.
Thanks, guys. I'm a bit all over the place, so sorry I didn't hold that together as well as I normally do, but you rocked.
That was good fun. Good fun, Glenn. Thanks so much for organising it.
No, it's okay. I love these conversations. They're great. The cracks are starting to show in my well-being. Men's Health Week screws me up.
We got one left.
Yeah.
If it's any consolation, Glenn, I've just done 2 weeks where I'm doing 8 hours of house painting every day and then 6 hours of counselling at night. So
wow.
I hear you.
I feel heard. Thank you. And I don't want a solution. I just want someone to hear my feelings.
Yes.
Well, great to meet you all, and I wish you well. No doubt we'll run into each other in some form.
Nice.
I see you, Glenn. Good luck.
We met before, Tanveer, on the phone after your scandal, if you will.
Oh, did we talk then?
Yeah. I sent you a whole lot of stuff on men's domestic violence.
Oh, that's you. Yeah. I do remember. Yeah, you sent me all this research.
Yeah.
Yeah, and it was useful. Oh, good to put a face to it.
Nice to see you and meet you.
So what city are you in there, Adam? Where are you?
I'm in Melbourne at the moment.
You're in Melbourne. Yeah, that's what I thought. I imagined you were in Victoria. I remember when you emailed me. Yeah.
Where in Melbourne are you, Adam?
Williamstown.
It's good to know. We get a lot of queries about people from the West, so it'd be good to know. I'll flick some people your way.
Okay. Are you in Melbourne too, are you, Carl?
Yeah, down southeast Melbourne.
Fantastic. Well, great to meet you all now. I thought it was a great discussion.
Yeah, well, take care, guys. Enjoy your Friday. See you, Glenn.
See you soon.